Tonight also marks the end of the national COVID-19 health emergency declaration here in the U.S.
Yeah, this comes a week after the World Health Organization announced the virus is no longer a global threat. After more than 3 years and more than 1 million deaths in the U.S., many consider this to be a symbolic end to the pandemic. But health officials warn not to let your guard down completely because this virus has not been eliminated.
Well, joining us now to talk about what the end of this declaration means is Dr. Ranney. She is the Deputy Dean at Brown University School of Public Health. Dr. Ranney, the CDC reported more than 77,000 cases of the virus just last week. It's still out there. It's now considered endemic rather than a pandemic. But in practical terms, share for our viewers what it means that this emergency declaration is ending.
The ending of the emergency declaration is really a financial and administrative step. It reflects two things. First, the level of death from this virus has really stabilized. COVID-19 remains the 7th leading cause of death for Americans, continues to kill about 1,000 Americans a day, but we're not seeing those huge surges in cases that we were seeing earlier in the pandemic. And of course, we now have vaccines and treatments to manage the virus. The end of the emergency means that we're pulling back on many of those emergency government and hospital functions that we needed earlier on in the course of this virus, but it does not mean that the virus has disappeared at all.
So calm down, but don't freak out. Or freak out. No, don't freak out, but don't completely calm down, I guess. Right. Millions of Americans did gain access to Medicaid because of the emergency declaration. So what happens to all of them now, and what are the remaining coverage options out there?
As a healthcare provider, this is one of the parts of the end of the emergency declaration that most concerns me. Over the course of the last 3 years, thanks to the public health emergency, we were not kicking people off of Medicaid. Now we have about 17 to 20 million Americans, including kids, recently pregnant women, elderly, disabled, who don't realize that they need to reapply for Medicaid. So we have a lot of folks that are in danger of losing their insurance. Many of us are trying to encourage people to go out and reapply, to consider whether they might be eligible for employer insurance, or if they're now age greater than 65 or have other chronic medical conditions, they might now be eligible for Medicare. But the big takeaway is don't take your insurance for granted as this public health emergency disappears. You don't want to show up at your doctor's office or at my emergency department and find that you no longer have coverage.
A really important point, Dr. Ranney. I'm wondering if it does seem like a foregone conclusion that we have now tools in our toolkit. We have vaccines, we have treatment methods, we know so much more about this virus, but it continues to mutate. There is the potential for future outbreaks. Is there anything that concerns you as you're looking forward into how not just our nation, but the rest of the world manages now COVID-19 being an endemic threat?
There are a couple of things that concern me. The first is I don't want us to forget that it is still out there. Now, granted, it's the 7th leading cause of death instead of the 3rd, but it is still killing a lot of folks. Getting those vaccines, testing if you have symptoms, and knowing that treatments like Paxlovid are out there still matters. The second thing that worries me as we pull back from the emergency is that part of that is that we're also pulling back from our tracking of data. It is going to be tougher for us to identify if there are new variants, if there are new surges, and then to mobilize the resources that are needed to combat it. And the third thing that worries me is that we've learned none of the lessons that we needed to learn as a country or as a globe from the failures early on in this pandemic. We have not improved our ability to share data between hospitals, states, the federal government, and the globe. We have not fully funded the development of new vaccines. And we've seen unprecedented losses of public health workers and healthcare workers from the public sector, which puts our entire system at greater risk should there be another surge of COVID or, worse yet, another infectious disease yet to come.
So important.
Really important. And you framed it up so well. The emergency may be over, but the danger certainly is not. Dr. Ranney, thanks for joining us today.
Thank you.